Welcome everyone. As you're joining, I wanted to real briefly address that I'm having a little bit of difficulty with my audio. We haven't had that problem with Alex's audio, so I'll try my best to mitigate some of those and mute my mic, but you will be picking up on some of the background noise from my fan, and we apologize for that. Okay, so we'll go ahead and get started here. I know we still have people coming in, but thank you and welcome. Greetings to everyone. My name is Dr. Marcus Cherry. I am the early career representative for the section on supervision and training with Division 17. And it is my distinct pleasure to help moderate this webinar here today. So the topic that we're talking about is certainly an important one, and we're extremely grateful for all of you who are tuning in. And real quickly, I just kind of wanted to talk about some of the things that are going on for us here as we do this. So Dr. Alex Pieterse has graciously accepted our invitation to speak on this matter. And while we are talking about racial trauma in the supervision context, I would be remiss if we didn't mention or focus on acknowledge that there's a very strong uptick in anti-Asian, Asian American, and Asian Pacific Islander racism in the overt sense. And so I just wanted to acknowledge that this webinar will speak to racial trauma broadly, but at the same time, like the balance between breadth and depth. So I trust Alex to lead us through his materials here. And real quickly, I just want to introduce him and then he'll take it over. So Dr. Alex Pieterse is an associate professor, the doctoral training director at the State University of New York in Albany. He conducts research on health-related outcomes associated with the experience of racism, anti-racism advocacy, and race-related aspects of counseling psychology training. He also works on the impact of self-awareness in the psychotherapy process. Dr. Pieterse is an associate editor of the Counseling Psychologist and the Journal of Psychology in Africa. Dr. Pieterse is a licensed psychologist whose professional experience includes conducting psychotherapy practice and engaging in diversity consultation. Thank you so much for joining us, Alex. Welcome, and it's all yours.
Okay, let me just share my screen here. And I'll pull up my slides. Okay. So Marcus, the first thing I would like to do is just to thank you for the invitation to spend some time talking about clearly a very important aspect of our practice as psychologists and psychologists in training. And then also just to thank those of you who have joined the webinar, taken time out of your Friday, and hopefully I can get through some material and we can open up for some Q&A or just some observations or reflections based on the materials that I have prepared for you today. I also think my title might be a little different from the title that is in the materials that went out. I think that title included a focus on anti-Blackness or anti-Black racism. I think my comments are going to speak to racial trauma and racism in a broader context, but I think clearly it will have applicability to thinking more narrowly about racism as it applies to, the experience of Black Americans or individuals of African descent. I will also tell you quickly that I failed PowerPoint 101. And so I have packed too much information on my slides, but I'm hoping that the slides can be distributed and it can serve as a resource for any of you who are interested in accessing the material. So let's jump right in. It is always important for me just to acknowledge that I am where I am because of other people in my life. It's a cultural tradition that I bring from my country of origin, which is South Africa. And in that regard, it's important for me just to acknowledge the mentors, the students in my life, the clients that teach me every day, my family, my sons, all who continue to shape me and assist me in striving to be a more complete version of who I can be. I also think it is important for me to share a little bit about who I am in regard to my identities. Without a doubt, especially in our field, I think who we are plays such a critical role in what we do, how we do it, why we do it. And so some of the subjectivities that I bring to this hour with you are my professional identities, which have been referenced. I'm an educator. I'm also a psychotherapist. I've had opportunities to practice as a supervisor. And then I have important personal identities that really shape, I think, the lens that I employ as I think about, write about issues around race and racism. I'm a Black cisgender male. I identify as heterosexual. So my identities comprise both privileged and oppressed identities. I am a father to 3 young Black men, raising young Black men in a racialized society. I'm a partner, a son, a brother, and then I'm an immigrant. I'm an immigrant to the great country that we live in and love. I'm also a citizen of the US, of New York, and of our small town in upstate New York, the city of Albany. Okay. So I think all of those identities are important for me just to acknowledge. And in the process of acknowledging, I would request that you reflect on, your own identities and how those identities are instrumental, even in how you will be engaging the material, how you will share the space. And so it's clear to me that my experience of race as a Black man informs what I bring to my study and my interest in race and racism. Over the past a few years, I've had the need to have, at times, very distressing, but really important discussions with my sons around what it means to be a Black male in this society. Some of these discussions have been located around interactions with law enforcement. And these are discussions, as I say in my tweet that I put out, that I do not enjoy, but these are discussions that are urgent and critical. And it's also, I think, wise just to acknowledge that we have been through and are going through a time in our country that has really highlighted the impact of structural racial inequity. And with that, we've experienced a heightened sense of anxiety. Our political process has been very uncertain. For some of us, the political process has been traumatic. All of us have been impacted by the pandemic to various degrees, of course. And so, we are gathering in this space, in this time, and I want to recognize and just acknowledge and respect the time and space that we are dealing with and living in. I have an overly ambitious agenda for our presentation. I need to speak quickly because I am verbose. But what I want us to do briefly is define racism and racial trauma, and then really jump into how racial trauma might play out in the supervisory context. So I want to share with you some potential scenarios around the occurrence of racial trauma, thinking about the potential impacts of racial trauma within supervision, and then perhaps most importantly, thinking collectively about intervention. How as supervisors we can intervene and possibly prevent the occurrence of racial trauma within supervision. I'm not sure if I'll have time to share a case, but I also want just to stress that the discussion around racial trauma within supervision clearly has impact for what takes place in supervision, but by extension has impact for what the therapist is doing with the client or patient, especially around racial dynamics. Want to highlight here that these are some of the what I consider critical references on racial trauma and supervision. For those scholars in the audience, you know, the empirical work around racial trauma and supervision is fairly limited. And quite a bit of that empirical work draws on qualitative methodologies at this point, which makes sense, you know, because diving into the experience of racial trauma in supervision lends itself, I think, to qualitative inquiry. But just to say that there is ample opportunity and ample need for ongoing empirical work looking at this phenomenon. So I'm drawing from some of these references as I share some thoughts with you. And again, I'm hoping that we'll be able to share the slides so people can access these materials. So let's set the stage. We'll go from broadly into a more narrow discussion of racial trauma. So, you know, we all appreciate that biologically or scientifically race as a construct is a myth, but we also acknowledge that experientially race is a reality. Okay? And I like the statement from Ken Hardy, who's a family therapist, that race is a major organizing principle in everyday life. And so the social reality of race, and by extension racism, has a huge influence in the lives and relationships of all of us. So I would imagine that even those of us who are participating in this webinar, you know, the lens that we are using to access this material to some degree is informed or influenced by our own racial backgrounds, our racial identities. Okay. So within the larger construct of race, there is the phenomena of racism. And, you know, some would argue that race, the purpose of race is essentially in the service of racism. The definition that I use in my work is this idea that racism comprises an ideological aspect, which is a belief of racial superiority. And then it has a behavioral component, which is the discriminatory, prejudicial acts of racism. And in some way, the ideology is used to justify and support the behavioral aspect. And certainly within our country, within the West in general, the racial hierarchy is such that whiteness has assumed a position of superiority, and non-whiteness, you know, Black, Indigenous, other people of color have been assigned a position of inferiority. So that's the racial dynamic that we are working with. And in some regards, we can think of racism really as the way in which our society is organized. This wonderful illustration from Miller and Garan in a book on racism and mental health really, I think, highlights the way that systemic racism is intertwined and really impacts almost every aspect of society. And here are some examples: transportation policy, immigration, discussion of immigration, which has been very topical over the past 4 years, institutions, politics, higher education, environment, etc. So I think it is useful to think of racism as an organizing principle. And again, within that organization are people, okay? And peoples whose lives are impacted by this organizing principle. Clearly, we cannot talk about racism without at least identifying the core construct in racism, which is this idea of whiteness. Okay? So whiteness kind of prevents the overarching frame in which we understand racism. And what that means, if we want to engage anti-racism, we need to engage a process of interrogating, dismantling, deconstructing the role of whiteness. So I love Frankenberg's definition of whiteness because it seems to have such urgent applicability in our current time. Frankenberg identified whiteness as a dominant cultural space that carries political significance, and the intention is to keep others on the margin. Okay? So in that regard, whiteness assumes the position of being the dominant culture, and by extension, therefore, sets the standards of comparison. And I think, you know, Frankenberg, writing in 1993, almost with kind of prophetic relevance to our current condition, in times of perceived threat, the normative group may well attempt to reassert its normativity. And certainly over the past 4 to 6 years, we've seen evidence of that attempt to reassert a sense of normativity and dominance. Okay? And so again, if we understand racism, we need to appreciate whiteness as the overarching frame, and then understand how those concepts filter down into the clinical encounters that we have, either as therapists and clients or as supervisors and supervisees. Okay. Clearly, there's a large body of literature that implicates racism in both psychological and physiological functioning. And the data is clear that experiences of racism are associated with adverse physical and adverse psychological outcomes. Lots of meta-analytic reviews that speak to that. And within that larger body is the idea of racial trauma. Okay? So there's been increasing literature on racial trauma over the past few years. Some of the work that I've been involved with my mentor and colleague, Robert Carter, is thinking about racism as a type of emotional injury. So in our work around race-based traumatic stress injury, we identify the emotional pain in response to a racist event as a type of race-based traumatic stress injury. And we emphasize injury, trying to draw some distinction between race-based traumatic stress injury and PTSD as a psychopathology. Okay, so not all racial trauma is psychopathological. If you approach it from the perspective of PTSD, then that's the kind of the frame that we're using. But for the definition of race-based traumatic stress injury, the idea is that a racist event is experienced as sudden and uncontrollable, and it has an accompanying constellation of emotional responses or psychological responses, which include depression, anger, intrusion, hypervigilance, etc. And that model has received lots of empirical support, largely because of the development of the race-based traumatic stress injury symptom scale. So lots of support for that model as a useful framework in trying to understand race-based traumatic stress. I also use a definition of racial trauma that perhaps is a little more expansive, but it's simply the idea of sustaining an emotional or psychological injury in response to an direct or indirect racist event. Okay? And so that allows us to kind of appreciate the emotional injury as also in response to structural, systemic, institutional racism as well. Okay. So let me share an illustration from my family life, which I think captures the theoretical notions in a very real way. So I'm just going to share one illustration because we don't have too much time here. I guess the illustration that I will share with you is one that applies to our oldest son. Who, while he was in high school, he's since graduated, but a couple of years ago while he was in high school, he would walk home from school to home because we were within in the school bus range, and so he could not access the school bus. But the route that he would access to walk home took him directly past a police precinct. And shortly after one of these really high publicity events around police brutality, our son Temba was walking home, and he said to me later on in the day, he said, you know, as I started getting closer to the police precinct, I started to feel anxious. And the way he described his anxiety was, I started to feel my heart go boom, 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 boom. So he experienced this kind of activation of anxiety, making the association between having to walk past a police precinct and his identity as a young Black man. And so what he did to accommodate his anxiety was he chose not to walk past the police precinct and added 2 or 3 blocks to his walk home, and then shared this experience with me later in the day. And then also, you know, added, as he was talking about his experience, said to me, you know, in a very innocent way, how unfortunate it is that for some of us, the people that are designed to protect us are the ones that we at times have a fear response to. So that simple illustration, I think, really captures some aspects of racial trauma in a broader sense. There's psychological, emotional activation. There's physiological activation, boom, 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 boom. And there's also behavior that is around avoidance, feeling fearful, feeling hypervigilant, and making a choice to add an additional component to his route to manage some of the anxiety. Okay, so that's a useful, I think, simple, but I think fairly apt illustration of racial trauma. Clearly, you cannot appreciate racial trauma without acknowledging the historical and generational component. So we think of historical trauma as a cumulative emotional and psychological wounding. And so, in the demonstrations that we've had over the past years around racial justice, some of the demonstrations clearly are not only for the individual lives that have been lost, but they really for lives that have been lost over the span of centuries. So again, the historical component is critical. So what relevance does this have for us in the clinical domain? Okay. Hemmings and Evans published an interesting study in 2018, which I think has direct bearing for our discussion about thinking about racial trauma in a clinical context. They interviewed mental health professionals, master's level, doctoral level, and they indicated a relatively small sample, but they indicated from their sample that 70% of their respondents indicated having worked with clients who endorsed racially traumatic events. However, 70% of respondents also endorsed having received no clinical training for responding to racial trauma. Okay? So that's an important and also somewhat troubling statistic. And so for supervisors, how do you think about engaging when in your own preparation, you perhaps have not had exposure to or thinking around clinical interventions with racial trauma? Okay. I'm going to just jump over these because I want to jump right into our focus on clinical supervision. So before we talk about supervision, I want to draw attention to the definition of supervision that I'm using to frame my thinking, published by Watkins fairly recently. But again, there are components of supervision that again lend itself to thinking about incorporating issues of race, culture, and trauma. Okay, so we think of psychotherapy supervision as a relationally based phenomena that's typically focused around treatment and also focused around education and training. Okay? So it's a relational phenomena that is about treatment, education, and training. And over the past years, the idea of the supervision relationship, again, has been receiving increasingly important attention. And also the idea that supervision needs to incorporate issues of race and culture to be effective. So again, the idea of needing to talk about racial trauma, fits perfectly within the framework of supervision that we apply to our thinking about supervision as a tool in facilitating development of supervisees. The literature has evidence of attention to race in supervision, racial microaggressions, the impact of racial similarity or dissimilarity, the idea of racial identity as an important aspect of the supervisory process, and then more recently, some writing and thinking on racial trauma. So how might racial trauma play out or apply to supervision? From my perspective, I think racial trauma have implications for how supervisors might enter the supervisory space. It also has implications for the kind of negotiation of race within the supervisory space, and also by extension, how impactful that space can be. So you can think of racial trauma as providing a context for supervision, but also the potential for racial trauma to be reenacted or enacted within the supervisory space. Okay. So I want to do a couple of things in the remaining 15 or so minutes that we have, so we can at least engage some question and answer. I want to highlight ways in which racial trauma could play out within supervision. I then want to draw your attention to a dissertation that examined the experience of supervisees from the perspective of race and racial trauma, and then share some thoughts about ways in which supervisors we can be perhaps more effective and more attentive to attending to race and racial trauma. So how might a supervisee experience racial trauma? Okay, and again, I'm using racial trauma from the perspective of a kind of broader application of the idea. Okay, so devaluation. Okay. So devaluation is essentially a lack of appreciation, a lack of recognition, a lack of incorporating a supervisee's experience around race within a social and historical context. Okay. Minimizing and avoiding, downplaying aspects of race within the supervisory relationship, attributing behavior or emotions that are associated with a racial dynamic to more intrapsychic, more personality concepts. Practicing whiteness. By practicing whiteness, I really mean engaging negative racial stereotypes, viewing white ideology as normative, viewing difference as deficient, etc. Okay. So again, if you are thinking about your supervisee, particularly a supervisee of color, experiencing some of these ways of being engaged with, you can start to appreciate how it raises the specter of a racial trauma response. Okay, the imposition of whiteness, not allowing or exploring cultural experience, okay. Encouraging supervisees to take on aspects of whiteness, okay. Delegitimizing experiences of racial discrimination, okay. Requiring that supervisees prove experiences of racial discrimination, okay. Questioning a supervisor's experience of racism. And I'm giving some examples here that unfortunately I think are fairly common. You know, I'm not sure he meant it that way. Other students have also experienced negative interactions with it. So really kind of downplaying the experience of racism when a supervisee brings that to you. And then perhaps the most critical one is failing to provide a sense of safety. And one of the most important ways in which the provision of safety is not addressed is by just not recognizing, not bringing up, not providing a space in which racial dynamics can be attended to. Okay? So the last bullet I would like to draw your attention to, not attending to racial aspects of the supervisory relationship, okay? Or putting the onus, putting the prerogative on the supervisee to address race. And again, I think these are some really common occurrences that take place within a supervisory dyad. And I'm thinking primarily about cross-racial supervisory dyads, with the supervisor being white and the supervisee being a person of color. And so I have a couple of illustrations here. The first being, can you tell me your thoughts or feelings about working with me as a white supervisor? To some degree, that's putting the, while that's inviting, that's also putting the onus on the supervisee to kind of address. Whereas I think a better approach could be a statement such as, I wonder if we can talk about how our racial cultural histories might impact our work together. So here you have a supervisor acknowledging, owning, taking hold of their own racial history and inviting the supervisee to kind of engage a process of discovery in the supervisory context again. So really critical, I think, for the supervisor to take the lead in that process. to try to kind of bring some kind of concrete sense to what I'm talking about, I'm pulling from this wonderful dissertation, a Laura Dupeton dissertation published in 2019, a phenomenological exploration of Black female therapists and covering in cross-racial supervision. And all I'm going to do is read these quotations verbatim and allow you to get a feel for what the supervisees experienced, some negative, some positive within their supervisory experience. Okay. Understanding, acknowledging racism and providing safety. I did my first presentation this year. I had a lot of built up experiences with racism and I was not really allowed to really express it. And it kind of came out at the training when people started asking questions in the training. I kind of exploded and cried in front of everybody. I struggled with trusting people. So I said, I don't trust my supervisor because she didn't allow the space to be vulnerable or open up. And when that happened, I got reprimanded. It was just like in the sessions, not having a voice with these white families and then coming back to a predominantly white workspace where I don't have a voice there either. It's like I tried to have a voice and it got shut down. Okay. Think of aspects of racial trauma. The need for courage and humility, application of relational skills. As a supervisor, you can't be afraid when someone comes in to share their experiences with you. She, referencing the supervisor, couldn't handle when I came in and said, I feel broken because I'm going to these houses and these people don't like Black people and it hurts. And she couldn't handle that. So it never got talked about. The need to engage and practice authenticity. Feeling that the supervisor is being their authentic self is a big deal. Some of the supervisors are rich in content and they are very smart. They have ways of looking at things or narratives that have helped me to look at things that have been really useful. But what I really need is a supervisor that has heart. Facilitating trust and understanding. Being able to express vulnerability. It sounds like me trusting that my supervisor is going to understand what I am saying within a broader context, and that I am able to speak to my specific experience as a Black woman in the therapeutic space, things that are triggering for me in that respect. Engaging cultural humility. I had a Caucasian male and he was wonderful. He was curious about my opinions. I worked in a school that is predominantly Black, so he would say to me, tell me more about what you think, which is totally the opposite of my initial experience. He gave me the space to use my conscience, use my culture, and allowed me to decline or agree with other people sitting at the table. So these are examples of supervisees of color, in this case, Black women, in what they experienced in the supervisory process. Okay? And for many of them, you can feel, as I'm reading those quotations, you can feel a sense of being shut out, being shut down, having their voice stifled, or feeling recognized, feeling seen when a sense of understanding was conveyed. Okay. So recall I said that the need to focus on racial trauma and the construct of race in the supervision context is also because there are potential clinical outcomes associated with not attending to racial trauma within the supervisory space. Okay. So these are some of the potential outcomes that I think are possible. And again, these are outcomes that pertain to the client or the patient. Okay? So the client's experience of race and racism is more likely to be overlooked or minimized if within supervision, the experience of race and racial trauma is not being attended to. Clearly, there's an increased chance of misdiagnosis when racial cultural experiences are not recognized or valued within supervision. The experience of trauma clearly produces an inauthentic self. Okay? And so with the client who has experienced racial trauma, they might be unable to bring their true self to their clinical experience if in supervision, the supervisee has difficulty bringing their own true racial self to their supervisory experience. So that's an example of kind of the parallel process. Okay. The client might experience a projection of the supervisor's fragility around racial dynamics, and therefore might experience blame, shame, or guilt for wanting to address their racial reality. So again, I'm arguing here that unless race is being attended to within the supervisory space and attempts are made at minimizing the occurrence of racial trauma, what happens in the clinical space with the client or patient might well be a reflection of what's taking place in the supervisory space. And so Pendry, a wonderful article on racial trauma, racial dynamics in supervision in the context of family therapy. And I'm paraphrasing Pendry here, but Pendry essentially says as supervisors, we need to step up. Okay. Pendry argues that firstly, the supervisor needs to create a context in which supervisory relationships, conversations about race and racism can take place. Okay. So for all the supervisors who are sharing space with us today, the prerogative is on us. We are the ones who need to take the initiative. And part of the reason is that there is an inherent power dynamic that plays out within supervision. And when that power dynamic is also incorporates a racial dynamic, which is power-based, it might leave the supervisee with even less sense of agency around attending to addressing race. Okay. So here are some thoughts about how to address, ameliorate, possibly prevent racial trauma in supervision. And these comments pertain directly to supervisors. Important that I am talking about supervisors. So the first point I would highlight is a recognition and a knowledge of your social location. And that is in regard to various identities, particularly racial identity, and also social location in regard to racial hierarchy within our society. So recognize, understand, acknowledge your social location. Engage your supervisee as a racial cultural being. Okay? So incorporate your supervisee's race and culture as part of the experience and not as a representative of a racial group. Prioritize the relational aspects of the supervisory process. In some of the comments or the quotations that I shared with you, you could see, or you could even feel the hunger for the relational component, for the need of the supervisee to engage with someone in an authentic, in a real manner. And practice courageous humility, practicing courageous humility. Okay. Being able to address, to be able to own, acknowledge what you don't know, to be able to acknowledge and own your own development of racial consciousness, racial awareness, and bringing that directly into the supervisory experience. Challenging your privilege. Okay. In regard to racial privilege, whiteness, challenging whiteness as normative. Okay. For supervisees who are engaged with supervisors who are willing to challenge, to check, engage their own privilege, it leads directly into opening up the space, okay, of authentic, safe exploration. And then the final one I would say is commit to anti-racist practice. Okay. So the question I have here is, if you view yourself as an anti-racist practitioner, how will your supervisee know that? What will you do? How will you engage in the supervision hour that will leave your supervisee with a recognition and understanding that they are engaged with a supervisor who is committed to anti-racist practice? What is anti-racist practice? The practice of identifying, challenging, and changing the values, structures, and behaviors that perpetuate racism. Again, taking from Milan Garan, you recall initially I shared with you the web of institutional racism. They also offer us the web of resistance. Internal strategies of resistance, external strategies of resistance. Challenging policies, external. Okay. Being aware of privilege, internal. Okay. Being reflective in your practice, being empathic, being willing to have difficult conversations. Okay. Incorporate those within your practice as an anti-racist supervisor. So Marcus, I am going to leave it there. I want to just open up for some Q&A. And if we can do 10 minutes of Q&A, I might be able to share a case illustration. If not, that's fine. But why don't I leave it there and just open up for reflections, comments, questions in the remaining few minutes that we have.
Excellent, certainly. So I have a few here that are going right now. One that I just saw. I actually put it in my back. So one of the first questions we have is, are there any protocols or protocol that is being used to link research between PTSD and race-based trauma?
So that's a great question. There is research that is looking at both PTSD and racial trauma and looking at the connection. And for that body of research, I would refer you to the work of Monica Williams and some of the work that came out of her lab at UConn. And so she has a couple of inventories that she utilizes that examines racial trauma in the context of PTSD. The work that I have been involved in looks at racial trauma as a non-pathological phenomenon. And so we look at it more from the perspective of emotional injury. And within the book that Robert and I published last year, we outline various tools that can be used, both self-report measures, but also a clinical interview schedule that can provide a clinician with more access into a client's experience of racial trauma. And clearly those scales can also be used in the empirical domain. So at the moment, there's a lot of research that is looking at thinking about racial trauma, both from a PTSD perspective and from a non-PTSD perspective. Marcus, should I be looking at the Q&A or?
I didn't unmute myself. Yeah.
Okay.
So I was reading, so there was a question about what if we're a supervisor affected by racial trauma by a white supervisee while in supervision? Is there what kind of recommendations, or is there any literature that you can think of?
Okay. So look, that is a very common question, which speaks to a very challenging occurrence, partly because of the dynamic, the power dynamic that is associated with, with that experience. Often supervisors are the ones that students or supervisors rely on for letters of reference, etc. So that becomes very difficult. So my suggestion then, and this is what I have suggested our students in our program who encounter experiences of racial trauma. The first is to be able to acknowledge who are the people that you can turn to that can provide support, that can provide instruction. And so in my case, I offer myself as a training director. Certainly the director of the clinical training setting is one. And then also, and again, this puts the supervisor in a vulnerable position, but I would always encourage supervisors to be able to bring their experience to the supervisory space. Now, I recognize that that's a little fraught. However, the work of reconciliation can only take place with authentic, genuine reflection. So identifying people of support, reaching out for guidance, and also adopting a sense of courage and bringing your experience to that space.
Thank you for that. So there's another one, there's a couple of questions here that I think are broaching the same area. So I want to try to combine them here.
Sure.
But for these, they look at, so racial trauma continues to be, so the question goes, racial trauma continues to be viewed through the binary of Black and white in the US, and it can kind of exclude some more of the global context. I had another question talking about specifically with Middle Eastern students, Middle Eastern identified students. So how do we kind of bring this anti-racism practice to people of color, and or like what research, I know this is a big question, and or what research is there out there for students that identify from Middle Eastern background?
Okay, so look, that is an important observation. So the material that I have shared with you today, while it might be couched in the binary, I think the concepts of the thinking can be extended to any dyad that reflects perhaps a cross-racial dyad. So I think that's an important piece just to observe. The dynamics of racism, I think, are often similar across racial pairings, because ultimately you're talking about power, you're talking about privilege, oppression, and so that dynamic is fairly constant. And so I think some of the thinking that we've shared applies to any kind of racial dyad. I think I believe there is more research recently that has been looking at the experience of Middle Eastern individuals in the context of MENA within the United States. And so I would encourage doing some literature searching around that. I can't point to a specific piece of work right now, but I have seen increasing representation of the experience of Middle Easterners in the context of discrimination within the United States.
I know we have questions pouring in, and I'm trying to get through a lot of them here, but I know you wanted to make a little bit of time for your case study here at the end. Perhaps we have time for maybe one more question.
I'm also happy to stay with questions. That's fine. So I'll be guided by you.
Sure.
Marcus, are you on mute?
Yes, I was trying to mitigate my background fan as I was scrolling for one that I was missing. This question asks, how does a supervisor of color negotiate the inherent privilege and power and privilege in the dynamic while addressing microaggressions from a white supervisee?
Sorry, I missed the first part of the question.
How does a supervisor of color negotiate the inherent power and privilege in the dynamic while addressing microaggressions from a supervisee?
Okay, that's a wonderful question. So the supervisor of color, on one hand, is in a position of power in regard to the supervisory context. And on the other hand, as the questioner kind of suggests, in regard to racial dynamics, they might be in a marginalized position. Okay? And some of that, how that plays out is questioning of authority, questioning of expertise, questioning of competence, etc. I would just draw you back to some of the thoughts that I presented before. Put the racial context on the table early on. Understand racial and cultural identity as part of the vehicle through which the supervisory relationship is established, and be willing to confront. Part of the role of the supervisor is to facilitate a deeper understanding within the supervisee of their own racial cultural experience. So clearly, that's a challenging and uncomfortable process, but the role of the supervisor is such that they model that process themselves. So, and for the supervisor of color, I would suggest find your support, find your supports, because that can be a challenging and difficult situation to process.
I found a question here that really speaks to me on many levels. So this one was very interesting. Can you talk about ways to set a frame to invite feedback from supervisees when a racially problematic situation occurs in supervision without seemingly or literally putting the entire responsibility on the supervisee?
That's a wonderful question. That's a wonderful question. So the first thing I will say to supervisors is that you do have the tools. You do have the tools to broach these, these interactions in your supervision. If you experienced a potential rupture that was occurring within your supervision in any domain, as a competent supervisor, you would engage, inquire, invite, and acknowledge your own role within that rupture. And so I think we take what we typically do and we apply it to race. If you can deal with the discomfort, acknowledge the discomfort, acknowledge your own fear, then that's part of the process. But you indicate your commitment to developing an empathic, open, understanding space. You inquire, acknowledge, think out loud with your supervisee ways in which you might have contributed to engaging a race-related rupture. Okay? And then you work through that process, you work through the relationship. So again, what we do when we encounter race-related ruptures is not different to what we do when we encounter other types of ruptures. But I think oftentimes it's the fear that gets associated with race that impedes or blocks that process. I've said this often when I ask my students to inquire into their clients' racial identity or racial discrimination. Often I'll hear from them that I'm not sure how to do that, and then I'll say to them, actually, you do know how to do it. You do know how to to ask an open-ended question. You do know how to use a reflective statement. And so I think often it's the discomfort and the fear associated with one's own racial experience that gets in the way.
I see, definitely. I don't know that there's much time for the case illustration, and I'm sad about that. But again, such wonderful questions here. So I had a few kind of asking about so what are maybe next steps in terms of training and or awareness. And as I ask that out loud, I'm kind of wondering if you might direct people to some of the literature that you've been talking about, or so what would be next steps for supervisors in growing and addressing anti-racism in the supervision context.
Okay. So look, again, I'm hoping I can share these slides. The initial list of references that I shared, I think are very helpful. There's work coming out of the UK. Mackenzie Mavinga has done some wonderful writing around race in supervision. So again, there is there are frameworks out there that supervisors can access. So I would encourage you to read, educate yourself. The next steps, I think, are also in regard to, we need more empirical work. We need more data that helps us understand the outcomes of racial trauma in clinical supervision. You know, we have the framework of harmful clinical supervision as a way of helping us to understand the potential negatives for racial trauma in clinical supervision. We need more kind of phenomenological research around supervisees' experience. And then for supervisors who are currently engaged in supervision, I would say engage the process. You know, you can't wait until you feel you are sufficiently equipped, because part of this is your own process, but bring your own experience to the supervisory space. Be explicit, own your racial identity. So again, it's both learning, educating, it's providing more knowledge, and it's also engaging. It is also engaging. Okay? But I think those references that I shared initially, people will find enormously helpful. A lot of those references also approach the thinking about the encounter from a dynamic perspective, which I think is a really useful kind of theoretical frame in which to understand how race and racial trauma plays out within both clinical work, but also within the supervisory context.
Yeah, thank you so much for that. As I'm reflecting on that response there, it makes me kind of think about and you spoke to this a little bit before, but sort of the courageous aspect of it in terms of leaning into wrestling with our own discomfort, but having these conversations in a very intentional way. And maybe even falling back on some of our training about rupture and repair, that will have ruptures in difficult conversations, and that we can follow that up with repairing and potentially making those relationships stronger and deeper. So I want to be very mindful of our time. We are very appreciative of having you here with us, Alex, and going through all of this wonderful information and such. Thank you everyone for joining. Just to reiterate, anyone who has joined or been a part of the webinar, we will send out a PDF copy of the PowerPoint slides through the emails that you registered with. So that should be coming soon forthwith. And again, we thank you so much, Alex, for your time.
Thank you very much, Marcus. It's been a pleasure.